Happy Friday. Thank you for joining our webinar. My name is Kristen Nisler, and I am the Director of Alliance Partner Business Development at Best for Dentistry. At Best, we are dedicated to bringing you the best-in-class solutions to help you further advance the success of your practice. We partnered with many key industry partners and developed programs to help you streamline your operations and run a more profitable and efficient practice. We are excited to announce the launch of Best Membership Plan powered by Plan Forward. With that, it is my pleasure to introduce our speaker today, Megan Lohman. Megan is the founder and co-CEO of Plan Forward, a SaaS platform supporting best membership plans for dental practices. Megan witnessed firsthand the issues dental practices were facing with membership plans and built Plan Forward to be an innovative and consultative resource for dental practices to drive growth and support the practice's role in exceptional care for their patients. Megan has authored many articles for leading dental publications, speaks nationally for many dental associations, study clubs, and meetings. As a successful and innovative female entrepreneur and businesswoman, Megan will share with us her best-known methods for achieving the ultimate success with your membership plan in your practice. Megan, thank you so much for being here. We are excited to hear what you have to share with us. With that, you can take it away.
Thank you so much, Kristen. We're so excited about this partnership with Best, and I'm personally very passionate about the membership plan model in a dental practice. As Kristen alluded to, I did witness this all firsthand as I was a front office receptionist in a dental practice for a little while, and then I moved into more the patient financial coordinator, back office, wear every hat role. And we created and rolled out a plan about a decade ago in our practice. And when I say we did it all the right and wrong ways, we really did, and it was just through trial and error that we have created Plan Forward and really crafted this membership plan experience to touch on all the key elements in a dental practice day to day to help alleviate the burden of offering solutions to uninsured patients and making it so easy for the practice to do that. But one thing that we've learned throughout the years of creating and launching Plan Forward is that there is just so much confusion and lots of different information regarding membership plans. So I think at least what I hope today is to give you sort of an A through Z story of the evolution of membership plans and kind of where they originated, how they've changed, and really how they can drive so much business impact in your practice when it's done thoughtfully and with people who have experience to help you get there. So with that, I'll go ahead and dive in to the presentation. Like Kristen said, I'm a huge fan of questions and just commentary throughout. So please, I welcome questions and comments as we go through. So, membership plans or any kind of savings plan or discount plan in a practice isn't new. So I would say about a little more than a decade ago is really when uninsured patients started really asking about solutions or alternatives to dental insurance, because the value of traditional dental insurance was really starting to kind of come into question. That was when, the early adopters began offering in-house plans to these uninsured patients. And really, that's kind of the earliest time where I've learned through, working with so many dental consultants that they really started recommending to practices to have a plan in place and helping these practices create them. It was around 2013 where the Affordable Care Act was implemented and insurance offerings changed really for that small to mid-size business. I mean, insurance changed for everyone at that time, but we had a lot of patients during this time where the employers no longer offered dental. And so patients really started looking for other alternatives. And so plans became much more popular with patients around this time. So not only was it dentist driven, but it was really driven by patients asking for help or solutions. It was about a little after that time when the early membership software companies started to come into the market. and consultative, a more consultative approach started to emerge with creating and running these membership plans. So then around 2016, these early adopters really began to use these software platforms to create impactful revenue for their business. Then you kind of keep moving down the line where trailblazers started to learn the do's and don'ts with membership plans. So having a plan is one thing and checking the box, but what's really the best way to optimize it so that it creates the most impact for the business and serves the patients. And then obviously our whole life really kind of is defined by pre and post COVID, I feel like, in today's world. So it was really during the COVID era and post COVID into last year where COVID really brought to the surface this huge need and a big opportunity for dentists and dental providers to serve these uninsured patients and to really grasp the opportunity at hand. And the market with the patients, you know, the market is now more educated than ever. The problem that we're still seeing, though, is that there's lots of different ways to structure plans. And so all of these different, you know, what's a discount plan? What's a savings plan? What's a membership plan? All of these sort of fall under an umbrella and everybody calls them membership plan. So I have a membership plan, but is it really optimized? So that's hopefully what you'll be able to take away today. The typical progression in a practice is you have a need. You know, patients are asking for a solution, so you create a plan. So you have this solution, and then you think, okay, check, you know, you check the box, you have a plan, and you move on. Then, you know, you run this for a couple years, maybe you get 40 or 50 patients enrolled. The patients seem like they're happy because there's a solution and you have an answer when they ask. And so you might think, okay, success, you know, we've got this, why change anything? You know, why would we invest in something like a software to help us, you know, optimize it? Or on the flip side, you have another typical progression where the whole thing is the same, except you run it for a couple years and now you have hundreds of patients enrolled. And so, you know, the thought might be, heck yes, we rock. We know what we're doing. All these patients, you know, are enrolled in our plan. But when you kind of look under the hood, and when we start talking with clients, it's, you know, is it profitable? How many patients are actually active? And what starts to surface is that it's kind of a hot mess. You know, you really don't know if it's making any money. We're not sure if the renewals are current. And so there's actually a cost to all of that. And so that's something, again, today that we're going to try to quantify. So this is just a story, you know, meet the Jones family. This is Tanya, the mom. She runs her own Etsy store. And Victor, the dad, he's self-employed and he's an entrepreneur. And because of this, they don't have a corporate entity that's paying for dental insurance. They have two kids, Sylvia and Grace, who are both healthy and active. And, you know, they are your traditional uninsured, you know, entrepreneurial family that walks into your practice. So Tanya comes in February. She has her cleaning. She learns about the, you know, the membership plan. She joins the plan. She pays her yearly fee that covers her for two cleanings, and she's happy. She tells her husband, Victor, hey, the dentist has this great plan. We can save some money. Why don't you join when you go in for your appointment? So Victor comes in for his recall, and he joins the plan in April. So then Sylvia and Grace, it's now summer, the mom brings them in for their cleaning appointments. And so Sylvia and Grace, they join in July. So the office has checked the box. Everybody, you know, is enrolled. You've collected that yearly payment and you got these 4 members on the plan. So everybody's happy. Well, then the year goes by and Tanya, being the type A organized mom that she is, she comes back in February, she has a recall and she renews. Perfect. Well, Victor, he's close. You know, he should have renewed in May. His appointment was, or sorry, he should have renewed in April. His appointment was in May. So he came in May, paid the, let's say, $360 fee and joined the plan again. He renewed. So the two girls are supposed to come in July and renew in July, but the family decides to take a vacation. So they reschedule the girls to September. Well, then September comes, it's back to school, things are kind of crazy. They can't get into the office in September either. So they actually make it back in October. So the two girls, they didn't have any problems. They weren't in the office since July, but they came back in October. The practice collected the 2 yearly payments and they renewed. This is probably all sounding very common, I would imagine. If you have a membership plan in your practice now and you're doing a yearly offering, this is very much how the process works. And there's not any glaring flag that, there's a missed opportunity here. But when you boil it down, there really is a missed revenue opportunity for every month that goes by, really every day that goes by, where a patient is supposed to renew and they don't. So how do you quantify this? So if you think about it, Victor renewed 1 month late. So there's 1 month. And then the two girls each renewed 3 months late. So there's 6 for the girls, 1 for Victor. So we're 7 months in missed revenue opportunity for this family. So if you kind of break an average plan, that's about $360 per year, break it down by month, that's $30 a month. So this family missed 7 months. So the total missed revenue opportunity for this practice is $210. And that may not seem like a big deal in the big scheme of things. But if you're one of these practices that out of the gates blew it out of the water and you have 300 members on your plan and you miss those couple months, that could be $63,000 of missed revenue that you missed in 1 year just by not renewing on the renewal date. So it does add up, and there is a cost for this lapse when someone's supposed to renew and they don't. Another thing that I think is really important to understand is the structure of the plan. So a lot of people offer a discount plan. There's even third parties out there that offer discount plans. And then there's what we refer to as a membership plan. And so I really want to break down and show you the differences and where the impact is different. So with a discount plan, it's where the patient comes in and pays a one-time fee. Usually, I'm just throwing it out, it's around $99. Sometimes it's $69, sometimes it's $129, whatever it is. The patient pays a one-time fee to access a discounted fee schedule. So all the services are discounted, so the patient's saving money and they feel good, but all of these services are billed a la carte. So when the patient comes in for their cleaning, let's say, they get the discount on the exam, cleaning, bite wings, and fluoride, and they're going to pay for those services at the time of service. So the thing that discount plans don't do is it really doesn't fully remove the fear of cost that uninsured patients have every time they walk through your doors. Because when you think about this from a patient's perspective, they really don't know. The average patient doesn't know what they're due for, especially when you deliver the news that they're due for a pano that time. Just because they might save 30% on their pano, they still have to cough up a bunch of money for an x-ray that they probably don't even think they need. So what we're trying to do is remove that fear of cost and give them this peace of mind that they can come in for preventive care. But a discount plan doesn't do that because they still are billed a la carte and they're still going to push back on things like x-rays when they're recommended because it's still one more thing to pay for. From a business perspective, a discount plan is not creating this predictable revenue either for the practice. You might get the patient to accept treatment that day, or you might get them to do the full new patient exam, cleaning, and x-ray, but they're not as motivated and that to schedule their recall, and therefore that retention and renewal rate drops significantly. Usually it's around 50% renewal. So the thing that we're really trying to do with a membership plan is not only help the patient by saving them money, because that's all patients care about. They want to save their money. Yes, if they're opting in, they care about their health, but they want to save money. but we also want to help change their habits and benefit the business. So that's really what a membership plan is designed to do. So when a patient joins a membership plan, they opt in to an auto renew program. This is where the preventive care services are bundled and they're included in the plan for a one-time set fee. And then some practices, at least our clients, many times join a one-time enrollment fee. But after that patient joins the one-time enrollment fee, they're never paying again when they're in the office for preventive care. So if you think about just like any other subscription, Amazon or Netflix, you pay it and you're charged every month. But when you're using the service, you're not actually paying at the time you're using the service. So you have that peace of mind that I'm active and I can access the benefits of my membership subscription as long as that payment's current. So because of that, it really encourages patients to come in every 6 months and get their cleanings, get their exams, and accept their x-rays because they know they're not going to be billed at the time of service. Typically also with a membership plan, the restorative treatment is then discounted. And like I mentioned, the patients never pay at the time of service. So I think that's the biggest differentiator, is that when the patient opts into the membership plan, they're really no longer paying at the time of service. They know exactly what they're paying and when they are paying it and what they're getting. And these plans, especially when they're auto renew, they create this predictable revenue and this predictable cash flow. So just to break it down again, the membership plan is a subscription plan offered directly by a provider to their uninsured patients. The preventive care is bundled. The provider sets the price. Generally, the payment options are monthly or yearly, and the restorative treatment is discounted. It's not included for that membership plan, but it's typically discounted. So that's kind of the biggest differentiator with a discount plan and a true membership plan. Membership plans are so advantageous to the business for so many reasons. They grow your production, they grow your profits, and they grow your cash flow. On average, our practices have doubled production per patient with their membership plan. On the hygiene side of things, the membership patients visit 2 times every year and they accept their x-rays. And really, when they opt in and they join the plan, even if they don't utilize all of those services, the business is still collecting those membership fees for those services. Again, we know that they use the services at a high percentage and they come in for their hygiene recalls, but that is about $360 of revenue that the practice is collecting every 12 months. Then when you look at treatment acceptance, membership patients accept more x-rays. They have this trusted relationship with their doctor and they're loyal to this practice because they're joining at this one practice location, which translates into 50 to 75% more treatment acceptance compared to uninsured patients. So really, when you can give these patients a transparent view with simple pricing and you bundle it and you set a price on it, then they just have this peace of mind and they come in every 6 months for these hygiene appointments. And the more they come in, the more you can, do your prescriptive preventive care and accept and take the x-rays and then present more treatment and hopefully take care of issues so they don't become catastrophic and extremely costly for the patient if they obviously don't do their preventive care and just come in for emergencies. So a sample plan generally looks something like this. It really is customized for each practice depending on the patient demographics. But for most general practices, there are 3 price points, one for adults, one for children, and one for perio patients. I would say more times than not, it's 2 exams, 2 cleanings, 2 fluoride treatments, your routine x-rays. So those bite wings are typically included. If you take anterior PAs, a lot of times they'll include those. When and if they're due for a pano or an FMX, Generally, that's factored into the cost of the plan. And then an emergency visit where that limited exam and a PA is taken, that's also included. So that's usually the preventive care that's covered for the set price. An average price for an adult is about $30 per month, give or take a few dollars depending on where you are in the country, but it's really on average about 30 bucks a month or $360 a year. For kids, it tends to be about $5 to $7 less per month than for an adult. And you may be thinking, well, what age, defines children and adults? And that's really up to the practice. I'd say the large majority follows the ADA recommendation with that kind of 13 or 14-year-olds, but we do have some practices that do, children up to 18. It's really your call, and that's the beauty of it. Everything is really up to the provider and what they feel is in their protocol for preventive care. Perio is another big example. Perio plans probably vary the most depending on if you prescribe or recommend a 3-month recall versus a 4-month recall, if you want to include a fluoride treatment at every visit, or maybe you wholeheartedly believe fluoride should only be done once every 6 months. Those routine x-rays are generally included. And again, the emergency visit. That also, the perio plan price ranges pretty drastically depending on your perio protocol and the size of your perio population. One thing I wanted to mention on the emergency visit is if you have a plan and you don't have an emergency visit included, I would highly recommend including it, because such a small percentage, I think about 3% of patients actually use it, but it gives patients peace of mind that they can come in, that they can have whatever problem they have looked at and evaluated by the doctor without having to pay for that. And so number one, gives patients peace of mind, helps these plans compare and compete with insurance plans, because insurance will apply the deductible or use one of those exams. So it helps these plans compete a lot with insurance. And if the patient comes in, you have an opportunity to present treatment that you may not have otherwise if they didn't come in. So that's kind of the standard or a sample plan. And then generally it's between 10 to 20, maybe 25% off all additional treatment for restorative care. And you might be thinking, oh my gosh, 15% off my bottom line. Like there's no way I would, offer a plan like this, especially to my uninsured patients who are otherwise paying cash, paying my full standard fees. My experience with that is most practices, they think their uninsured patients are paying their full fees. But if you actually look at it, how many times are you writing off x-rays because the patient doesn't have insurance? Or how many times are you like, okay, we'll give you a 10% discount because you don't have insurance? Or if you pay cash, we'll give you, this discount. So many practices are already discounting if they don't have some sort of streamlined program like this for uninsured patients. But for a fee-for-service practice, you might really be thinking, there's no way I would offer some sort of reduced rate for my whole entire uninsured patient base. And this case study is so interesting because it really does show the value of when patients accept a membership plan, what it can do for the business side. So this is something we did. It's a case study from a very traditional solo independent practice, one dentist, about 1,800, I think, active members. And we looked at how many uninsured patients did this practice see over the course of 24 months. So it was a 2-year time period that we looked at. And this practice had seen 347 patients in 2 years. So for any reason, emergencies, restorative appointments, preventive care appointments, just 347 people came in over the course of 2 years. Of course, we all know the ADA recommends 4 cleanings over the course of 24 months. And then in this practice, 1 cleaning appointment was $175, give or take white wings and fluoride. So when you average all of that out, the total potential, so if they would have had perfect 24 months, if all 347 uninsured patients came in, got their 4 cleanings, and paid $175, they would have completed 1,388 cleaning appointments, and they would have generated roughly $243,000 of revenue just from the uninsured patients for hygiene. I love asking for guesses on how many patients do you actually think had 4 cleanings in 2 months, but I'll just give you the answer. We literally went through and looked how many at these patient accounts, how many patients had how many cleanings. And what we found was that only 2 patients actually had 4 cleaning appointments over the course of 2 years. Again, these are uninsured patients. 47 of the 347 had 3 cleanings, which is pretty good, right? They only missed 1 over the course of the 24 months. 100 patients had 2 cleaning appointments, and 90 patients had 1 cleaning appointment. So if you add all of that up, they completed 439 cleaning appointments over the course of 2 years to this uninsured base of 347 patients. So while they had this revenue potential of $243,000 if these uninsured patients were coming in and paying their full fees, in reality, the patients stretch out their cleanings. They come in once every 9 months or once a year if they're doing cleanings. And actually, when you do this math, there were 31% of the patients that actually never had a cleaning. They actually just came in for emergencies or restorative care. So the practice only collected $76,825,000 over 2 years from these uninsured patients just because they weren't coming in. So with a membership plan, yes, you typically do reduce your fees, and it could really vary. Sometimes it's not by much. But yes, you would reduce your fees to incentivize the patient to join. And yes, you may reduce your overall revenue potential, but you're capturing 100% of that revenue per patient because they're opting in and you're collecting, and it's predictable revenue. So if this practice would have had all these patients on a membership plan, they would have added an additional $131,000 just from hygiene. So again, these are real numbers from a different practice. This is their spend comparison over the course of 2019. So looking at spend per patient, or you can say value per patient, all uninsured patients not on the membership plan divided by the number of patients that were seen gave an average spend per patient of $172. When you looked at all membership patients, total spend from membership and restorative care divided by the number of membership patients, the spend per patient or the value per patient was $515. So that's a 3x increase from an uninsured patient to a membership patient in the value that they're investing in your practice. And why is that? I mean, really, it's because they're opting into their oral health. They're showing up for those appointments. They're, accepting their x-rays. The practice is presenting more treatment, and the patient is more receptive to having that treatment done because they get a discount. They're listening. They're not worried about, well, does my insurance cover this? And if it's not, then, they don't accept it. And it's not on the other side of the equation where they're truly uninsured and they're just now terrified that they have a treatment plan and they don't know what they're going to do. So membership patients, the data supports it time and time again that membership patients are just the most valuable patient in the practice. So many, I know this is a lot of numbers, hopefully this is helpful, but many office teams, especially if this is a new concept, are always thinking, well, how does this compare to insurance? And especially now, this is like the hottest topic where practices are reevaluating their insurance participation and strategically starting to drop some of the worst, the low payers, which makes perfect sense. So it's helpful to see how a membership plan compares to some of the traditional insurance plans out there. Keeping in mind, sorry, I need a little sip of water. Keeping in mind that this example is comparing a traditional insurance plan if a patient's going to go purchase it on their own. So a traditional plan, the premium, a premium is about $30 a month for a standard plan with a $100 deductible and a $1,000 maximum benefit, giving you the 100, 80, 50 standard coverage. So if a patient was on traditional insurance and they came in and got their 2 recall appointments, just for simplicity, we're going to pretend that adult fluoride is included, which it never is. But let's say they come in for their 2 cleanings, and the practice files the claims, and the claims pay at 100%. The benefits used is going to be $455, let's say. So out of that maximum benefit, you've used $455, and so you have $545 left in remaining benefits for treatment. Let's pretend the patient needs a filling, and it's $180. Well, your deductible is going to apply. That leaves an $80 balance. And so the benefits are going to kick in here at 80%, but it's only going to cover 80% of that remaining balance. So the benefits are going to be $64 from the insurance company. The patient's going to pay $116. So when you add up the out-of-pocket for the patient, the $360 in premiums plus the $116 for the filling when you factor in the deductible gives you $476 in out-of-pocket spend for that year. If a patient is on a membership plan, the membership fee, again, it's about $30 a month. Preventive care is all included. And let's say they get a 20% off restorative care. So again, all the preventive care is included. There's no need to think about remaining benefits or anything like that. If they still need the filling and they get 20% discount, they're going to save $36. So the balance is $144. So that's what the patient pays. Cut and dry. They paid $360. They pay $144 out of pocket for their filling. So they're out of pocket for the year's $504. Comparable. It's not drastically different. So my next question I usually get is, well, and especially from the perspective of the patient, well, if I have a big treatment plan, then I want that insurance plan. So maybe I'll get the membership plan when I, don't need work. But if I do need treatment, I'm going to join this traditional insurance plan so that it'll cover this care. So I think it's worth showing the same example with a larger treatment plan. So that's what I'm going to do. So let's say a patient needs 2 crowns and they're $3,000. Let's say, $1,500 each. So the patient comes in with this traditional insurance plan, has their cleaning appointments, and they accept the treatment on the 2 crowns. So the deductible applies, then the balance is $2,900. But you would imagine for a major, it would cover 50%. But because of that lovely maximum benefit, instead of paying half for that crown, it's actually only going to pay $545 for the crown because they've already used part of it for the cleanings. So the patient responsibility is actually $2,455. So the out-of-pocket with the traditional insurance for the full treatment plan and the preventive care is $2,800. On a membership plan, same membership plan, preventive care is included. Let's say the patient saves 20% on the treatment plan. So they save $600. They're going to pay $2,400 out of pocket because there is no deductible and they get the full 20%. So the patient responsibility is $2,400. The membership fee, the premium, I guess, or the membership fee is $360 plus the $2,400 out of pocket. The patient actually spends less out of pocket for a larger treatment plan on the membership plan than they would the traditional insurance. I know that was a lot of numbers. Hopefully that made sense. So when office team members talk to me about how this really is a strategy for growing their patient base and moving away from insurance dependence, I show them this example because it takes getting comfortable with having the conversations around premiums, maximums, how much out of pocket have you spent, This is how much our plan costs versus what you're paying out of pocket currently. And as you move toward open enrollment, which is in October, these are the types of conversations you want to start having, because sometimes patients don't even know what they're paying. Many times they don't. So if you can just show them, hey, last year you paid this out of pocket, and how much are you paying in your premium? And you do the math for them, and then you show them the cost and the benefits of your treatment plan. Many times, especially if an employer is not covering the insurance premium, many times the membership plan is going to be in their best interest. So all of this sounds great, but why in the world would you invest in a software to manage this? And there are so many reasons why. And like I mentioned, when we first started our membership plan, it was an annual payment, like my example with, the Jones family. So we did it that way, managed it manually. Then we switched it to a monthly option, again, managed it manually, and it grew. Because it will. The more options you have and the more people can accept it and afford it, your plan's going to grow. It presents more administrative nightmares as the plan grows. Again, and you're not capitalizing on the full potential of the plan unless you're auto-renewing those plans. So truly a software comes into play for practices who want to grow their uninsured patient base and really view this as an opportunity to strengthen the business side of the practice. And not only the business side, I shouldn't say that, because these patients are so loyal and compliant. They're just the easiest patients for your hygienists, for your front office team, for your financial coordinator, and ultimately for your dentist. So the software takes care of these 6 core functions. Number 1, auto-renewing the plans. The software is going to send notifications to your patients and to your practice regarding anything you need to know about, including if you have new patients that enroll, online or, from your website. It gives you a simple dashboard so you can see who's on the plan, what renewals are coming up, etc. It gives you an easy way to manage your reporting and to show, your top line revenue and how much you're gaining or losing if patients are growing or shrinking. You should be looking at that stuff if this is truly part of your strategic plan. A software allows you to streamline any changes to the plan. So let's say you're running your plan for 5 years and you got a new software or a new piece of equipment and you want to add something, or you want to throw in Bellscope or a teledentistry appointment, or your pricing changes. This makes communicating those changes and making price changes so much easier than without a plan or without a software. And lastly, eligibility. And this is so important because without a software, really the office manager or the one point person in the practice really is a human, and all of that knowledge is in their head, and they have to remember all the details and to make sure all the information is up to date and consistent across spreadsheets, in the account alerts in the practice management system, making appointment notes that renewals are due or whatever the case may be. One person is generally responsible for this, and this is how stuff falls through the cracks and things get missed. Also, if the information in the spreadsheets or in the practice management system isn't up to date, then if somebody's covering for that office manager or you have turnover, when the person answers the phone and the patient says, hey, I'm a member of your membership plan, you can easily jump in to a membership software and confirm whether or not that patient truly is active, their payments are current, and they're eligible for the services included in the plan. So like Kristen mentioned, we are partnered with Best, and just so looking forward to serving these patients and these practices. But you might be thinking, well, what's so special about Plan Forward? We definitely pride ourselves on having gone through this whole experience personally, and we have crafted the entire process of the business to really hit on the key points that we know are important to you. Number 1 is pricing. The practice needs to know that the plan is profitable. You want to know that what you're offering does benefit the patient and that there's real value there. but any business owner is going to want to know that it's a good business decision and that any patient who joins the plan, you're not taking a loss. So number one, our pricing analysis is thorough, and we help you to make sure that you're focused on profitability. The second piece is this is your business, your plan, and your practice. So everything that we help you create is white labeled, putting your brand first, and this really helps with patient acceptance. Your patients are coming to you because they like you and they trust you. You already have a relationship with them, or if they're new patients, you have that opportunity to earn their trust. And so when you pull out a brochure that has some other random company logo on it, it just feels like another third-party insurance plan, really, that you're recommending. Instead of pulling out materials and showing them, hey, this truly is, Dr. Jones DDS Smile Club, and that's what branding is front and center on all the materials. It just helps with patient acceptance. And the last piece is accounting. How do we account for simple reconciliation and being able to go back and report on and measure whether or not the plan is doing what we want it to do for the business? So our providers own the merchant account that's charging their patients, so that you get monthly statements, you get monthly statements to reconcile the top line gross deposits. And then on a monthly or every 6 months or yearly, the way we help you create the practice management setup will help you with all of your reporting and analysis. So there's really kind of 3 buckets that you'll want to be measuring as you offer these plans over time. So number 1 is income. You need to be able to show gross top line revenue that you've generated from your membership plan. Then you're going to want to know, how much have we given away, or how much have we had adjusted for those membership payments? So you're collecting top line revenue. Then you want to be able to show, okay, how much have we adjusted out for preventive care? So you can see your utilization. And then how much are we paying in any kind of administrative or processing fee to manage the plan? So those are your expenses. So when you can show those 2 numbers, top line income and your adjustments and expenses, then you can see your profitability. The gravy, or the icing on the cake, is being able to show and report on treatment acceptance among your membership patients. So in your practice management system, we would advise doing it in a way where you can report on showing those restorative adjustments so that you can get the total and figure out the math to show what your treatment acceptance is. So if you're going to use this as a strategic growth opportunity, knowing these numbers is going to help you year over year to determine, do we need to raise our rates? Should we include something? Should we not? What's our treatment acceptance? Are these patients, the most profitable patients we have? If you can't easily report on these numbers, it's really difficult to tell if it's doing what you want it to do for the practice. Our process also is based on lots of experience. So we really do have a proven formula that's really kind of 3 steps: creating the plan, implementing the plan, and growing the plan. So from that creation stage, you can keep a plan if you already have it, or we can help you reevaluate it to see maybe if you want to make some tweaks to the pricing or the services, and let you ultimately set all of those terms for the plan, and then design and print and deliver your marketing materials. The implementation is live with a client success manager, where your team would get really comfortable with what the plan is and the value of it, so that they can advocate for the plan. Surprisingly, or maybe not surprisingly, a lot of these conversations happen in the chair. So it's just as important that the assistants and the hygienists and even the doctor be able to, or be comfortable enough to even say, hey, we have an in-house plan for uninsured patients. Do you want to talk to Susie at the front about details? So just getting the whole team on the same page and really believing in the value of this is so important. So that's what we do, and we help your team understand all of that. And then ultimately we'll help make sure that your practice management system is set up so that you know how to check patients out and you know how to make adjustments and things like that. So you're officially launched. And then when it comes to growing, that's when we work with you regularly to make sure information's on your website if you want it. We offer continuing education, and ultimately your client success manager is dedicated to you for questions and also strategy if you see a bigger opportunity and want to put some proactive efforts into marketing and growing the plan. That's what we're here for. So our pricing, we do charge a one-time implementation fee for the analysis and the marketing and the training, and it's a one-time $399. For the best premium members, they have taken care of that for you. So there is no implementation fee for the best premium members. And then once the plan is launched and members start joining, it's $3 per member per month, and that's active membership patients only. So I love sharing this story because it really does highlight how if you have a plan, just by making a few tweaks, you can improve it with the same exact team. So this was a story, love Dr. Gerald. She came to us in 2020, and she was so frustrated because they had this plan for 4 years. These were the materials that she created, which to her credit, just going through this process and getting something launched is super entrepreneurial, and it's hard to do it. So she put the membership idea together. She put the marketing materials together. This was an example of what the plan options were. And she was just convinced that the team was not selling the plan. She was just convinced that they weren't doing a good job presenting it, and that's why the plan wasn't growing. And so after a couple conversations, and once she sent the materials, we thought, this really, you have a great foundation, but there's an opportunity to just refresh this plan. So with a simple strategy of revising the pricing and the plan structure, redesigning those marketing materials, and just making it simple for the patient to digest the information, and retraining the team, simply representing almost the same information just in a different way to the same exact team can have profound effects. So after we did this was what their new materials looked like, and we relaunched in May of 2020. We adjusted the plan price because actually patients joining her old plan were paying more out of pocket to be on the plan than they would have if they were just paying out of pocket. So there's not a lot of incentive there for a healthy adult patient to join the plan if they're paying more. So we adjusted the plan price and just retrained the same exact team. And so, over the course of now almost 2 years, they've been rocking and rolling, and they're, much more confident in this plan, and such that 148 members they have currently active on the plan, and they're generating just under $60,000 in recurring revenue. So my last slide here is just showing like an exercise, what we do if clients are interested, just to kind of show the growth potential. Like I mentioned, we know many practices have a plan already. So what's interesting to look at is just to plug in the number of current members. In this example, I used 250, and showing what a renewal lapse, so quantifying that renewal lapse. On average, one patient renews about 8 weeks after the renewal date. So if you break down that average plan price into months, that's about $60 per member. So in this example, with 250 members, that's a potential loss of $15,000 in revenue due to renewal lapses. So step one is generally our immediate goal is what does our revenue look like if we just capture 100% of renewals? Keep the members the same, but we just capture 100% of it. Most practices also have an adult and a child plan, or fewer plan options because it's easier to manage. So let's say you have an adult plan of $299 and a child plan of $99. This math is based on 90% of your patients are going to be on that adult plan, and maybe 10% or less are on the child plan. Your adult revenue in this example would be like $67,000, and your child revenue would be $2,500, rounding. So your membership revenue in the first scenario, the current membership revenue is probably close to $70,000. So the short-term goal is to grow profitability and give patients more options. So we're going to try to just adjust the profitability and help people have options that really fit their health. And a lot of times that's adding a perio plan. So, or adjusting the price of the child plan, because a lot of people are way undervaluing the price of the child plan, just because if you only have a yearly option and a whole family is joining the plan, that's a big one-time lump sum for a family to pay. So the knee-jerk reaction is to make the child plan next to nothing. So when you adjust the plan so that it's more profitable, show more value, and at a perio price point, then your percentages are going to adjust, because your perio patients are not pigeonholed into this adult plan that they really shouldn't be on. They're accepting this perio plan, and their 3 or 4 visits a year are included in that. So that's going to help more patients accept the plan. And if you offer a monthly option, that's what helps more patients be able to afford it and cash flow it as well. So just by doing that, making some tweaks, improving the profitability and offering, more plan options, you would increase your membership revenue by $30,000, even with keeping the same number of patients on the plan. And then maybe the long-term goal is to scale the plan. So we would look at, okay, what's your goal? What do you want to do over, the course of the next couple of years? Maybe you want to double the plan participation. So then we would just plug in what those numbers look like. And so keeping the plan options the same, but putting a little more proactive thought and strategy into growing the plan is where you can start to target, what do we want our future membership revenue to look like. So I know that was a lot of numbers. Hopefully it makes sense. I did throw in a couple of just sample reading materials. Usually people want to know what those look like. So here are just some different brochure designs. It's always customized with your logo and your colors. And if you have 4 plans or 2 plans, whatever it is, that will be taken into consideration. And then here are a couple client samples. They wanted their team on the front cover of it, so that's kind of fun. And here's another one, Dr. Julovich with his Smile Club. So it really is your brand, your plan, your details front and center. And we just want to be here to help you grow this portion of your practice. Kristen, with that, hopefully oh my gosh, I'm almost out of time. But there's my contact info if anybody has questions.
Thank you so much, Megan. That was very thorough and helpful in understanding just all the benefits to implementing your specific membership plan within a practice. And I know there's kind of a lot of information out there. And so I think you did a good job simplifying it and just showing the revenue opportunity, especially with the I think we're seeing more folks maybe moving away from insurance or, looking for this opportunity. And it's, obviously clearly beneficial for the patients as well. So if there's any questions, I haven't seen any typed in yet, but wanted to give folks an opportunity to ask questions as we still have a few minutes left. If not, we'll record this and kind of the next steps in working with you, Megan. I don't know if you you kind of discussed it, but I'll include that in the follow-up email.
Yeah.
But it'd be signing up for a demo with you, right?
Oh, yeah.
Going through that pricing analysis and.
Yep, okay. Absolutely. Just feel free to reach out and I can, schedule them and get connected so we can talk more specifically about their practice and show a demo for sure.
Perfect. Yeah, I'll send out the link where they can schedule a time to meet. And
okay.
I see something in the Q&A. Do these membership plans ever cause problems with PPO contracts?
Not that I have ever heard of, and there's regulations supporting membership plans, specifically saying in many states that these are not insurance. So if you could elaborate more on maybe what kinds of problems, I might be able to answer a little bit better.
Yeah, I think I can.
And also, all the PPO contracts are so different. And so it really depends on, the language in those contracts. But many practices are in network and also have a membership plan.
Yeah, I'll open up the mic. Do you want to ask that question live? Does that answer your question, Dr. Pearson? Oh, looks like you typed something back in.
PPO fees are higher than membership discount. There is a most favored nation clause, if that's what you're referring to, that if you are in contract with a specific insurance company and there's that clause in the contract, then those patients have to be offered the best rate. So the lowest rate, the most favorable rate. So if that's your question and if that clause is in there, then you would need to honor your membership price to those PPO patients. Most of our clients, I mean, I don't think I've ever seen a membership discount be lower than a PPO reimbursement rate. So I think those, maybe some of those are grandfathered in where they're pretty close to the standard fee, or maybe they're just a few percent off of the standard fee. But most times the membership price is higher than what the PPO would reimburse. So they're already getting the most favored price. But that, again, it's contract by contract specific. So I would defer to what that contract says.
Perfect. That answered his question. Thank you.
Yeah, absolutely.
We've got a couple more minutes with Megan. Any questions before we wrap up here?
Also, I think they can get a wealth of information on the landing page through the BEST portal. Is that right?
Yes. Yeah. So we have through our hero page, and this is again, we'll link to we have a landing page. That'll be in the follow-up email. I don't have it handy to put in the chat right away. Sorry, should have thought of that.
No worries.
I'll get that out via email.
Perfect. But yeah, if anything comes up or anybody wants to connect, there's my email and phone directly, our website, and obviously touch base with your BEST account manager, and I'm sure they will connect us as well.
Yep, it's an easy process to get connected. So we'll send that information out. And if not, if you need it immediately, it is on the hero page on our website in the portal. Go to membership plans in the member area, go to plan for BEST membership plan. All right. Thanks, everyone. Thank you, Megan, so much.
Thanks, Kristen.
And thanks, everyone, for joining. Enjoy the rest of your Friday.
Thanks, you too. Bye-bye.
Bye.